Katie, can you let me know when we have a quorum? Thank you. Good afternoon for everyone who's joined us. It's 1:30, but we're just waiting to get our quorum before we get started.
I was just texting people. You have quorum.
I have quorum. Okay, then I will get started. Well, good afternoon, everybody. Welcome to the September meeting of the Continuum of Care. With a quorum present, we'll go ahead and get started. And I'll call this meeting to order. A few housekeeping announcements. Please remember to mute when you're not speaking to create a positive experience for everyone. Members who are attending by phone only, please remember to press #6 to mute, and you can unmute by pressing, I'm sorry, it's not pound. Please remember to press *6 to mute and unmute by pressing *9. Nope, that's not right either. Try this one more time. So if you are attending by phone only, you can press *6 to mute and unmute, and then *9 to raise your hand. Sorry for the confusion there. Okay, but before we dive into the content of today's meeting, I'd really like to take a moment to recognize and thank board member Bruce Liggett, as this is his last meeting before he retires from the Maricopa County Human Services Department. As many of you know, Bruce has a distinguished reputation and distinguished service in many arenas in our community. But today I want to specifically recognize him as being a great champion for ending homelessness in our community. On behalf of the Continuum of Care Board, we would like to present you, Bruce, with a proclamation acknowledging your tremendous efforts and your lasting impact. And I am going to go ahead and read the proclamation. It says, "A resolution of appreciation for Bruce Liggett. A resolution expressing the appreciation of the Maricopa Regional Continuum of Care to Bruce Liggett for his dedicated service to the region as a member of the Maricopa Regional Continuum of Care Board and almost 50 years of human services leadership in Arizona," which is just tremendous. Whereas Mr. Liggett served on the Maricopa Regional Continuum of Care Board from August 2015 through September 2021, where he provided significant support to strengthen the homeless response system. And whereas he provided invaluable leadership when he was responsible for Arizona's social safety net programs as deputy director at the Arizona Department of Economic Security. And whereas through Mr. Liggett was appointed by Maricopa County to serve on the Human Services Campus Board of Directors, where he oversaw the opening of the Welcome Center, which has allowed the HSC to expand capacity, meet clients more expediently and more effectively, coordinate services to empower people to end their homelessness. And whereas through Mr. Liggett's vision, led the community in transitioning those staying in the men's overflow shelter to safer and healthier housing options. And whereas Mr. Liggett was a founding member of the Funders Collaborative, a group of organizations that funded temporary shelter and obtained additional funding to address homelessness in the region. And whereas Mr. Liggett was a catalyst for the development of the Regional Collaborative on Homelessness, where he contributed substantially to the regional efforts to address homelessness. And whereas Mr. Liggett led Maricopa's county response to COVID-19 and those experiencing homelessness, which has resulted in over 1,500 individuals and families having the ability to safely isolate during their illness or while awaiting test results. Now, therefore, be it resolved that the Maricopa Regional Continuum of Care Board thanks Mr. Bruce Liggett for his exemplary leadership and commitment to this region. And this was passed and adopted by the Maricopa County Regional of Continuum Board the 27th day of September 2021. Congratulations, Bruce, for your tremendous service to our community over all of these years. It's just amazing. At this time, I would like to invite any members of the board to share a few words. I'd also like to invite any members of the public to share words, and you can do that by emailing your thoughts to Katie Gentry at kgentry@azmag.gov, and then staff will read aloud those comments. If we don't receive those comments, if we receive them later in the meeting today, we will circle back at the end of this, at the end of our meeting and continue to read comments. So are there any board members who would like to offer comments to Bruce? You're going to have to, I think, because we don't have the chat function, board members. Oh, Jackie.
Madam Chair. Yep. Okay.
Yes, I see your hand up, Jackie, please.
Bruce, it's really mixed emotions that I hope it's not goodbye. I hope it's happy trails until we meet again. But I couldn't be happier. You know, you and I have had the opportunity to work together in so many different roles, and your wisdom and your passion for this work will be truly missed in this continuum of care. But on a personal level, I'm just so happy for both you and Jody as you transition. This is really an exciting and beautiful time of life that I hope you both are thoroughly embracing. So know that I'll always love you both, and I wish you the very, very best.
So nice. Okay.
Oh, wait, there's more, Bruce. Hold, please. Marshall.
Yeah, Bruce, getting through this one. So I just want to say, Bruce, thank you. He knows how I feel about him, but I will tell you publicly, thank you for being a partner. Thank you for being a friend. I call him the brother from the other mother. You know, we do have a little slightly different skin tone. So, you know, folks may wonder where it comes from, but nonetheless, for Bruce, I want to thank you. When I came into this role almost 4 years ago, not having a detailed background, if you will, in social services, you welcomed me, you embraced me, you allowed me to kind of ask you the crazy questions. And I always had a special heart for you because of who you married in terms of your wife, Jody. But thank you for everything. I'm really excited for you and this new journey in life for you and for Jody. And I'll say, please don't stop taking my calls. And when you're turning up one, while the rest of us are at work, be thinking about us as, you know, you take that little shot that we talk about every once in a while. It's kind of clear liquid that you're supposed to be over 21 to drink. But Bruce, seriously, thank you for your love and your support and your friendship, and wish you nothing but the best, my friend. Genuinely nothing but the best.
Thank you. Wow.
Thanks, Marshall. You want me to get through them all, Bruce, or do you want to respond?
No, go ahead.
Go ahead. Okay. Tad.
Yeah, no, definitely. Thanks for the opportunity to speak. And Bruce, I just want to thank you so much for all your collaboration, and really me being, you know, now it's like 6 or 7 years ago, I was the new guy coming from the healthcare field, and having an opportunity to work with you and my team work with you, and so much how you embraced us and really taught us a lot. But also, you know, really had the opportunity to see you in action, and how much you valued collaboration and working side by side with key folks, and really appreciated your time, your effort, and then also your energy and the passion that you've definitely demonstrated for some of the most riskiest, at-risk people out in the community, and really taking your passion and really running with it. So I really appreciate all your work, and hope you the best. And as Marshall said, and Jackie, hopefully this is not a goodbye. It's a, something different, so really appreciated all the work with you. So
Thank you, Ted. That means a lot.
Thank you, Tad. Chris.
Wow. Okay.
Hey, Bruce, I am the new guy and I'm really sad that you're leaving right when I'm getting here and I could learn so much from you. I know we've worked for years. Partner, you're such a friend to the cities. Those are huge shoes to fill. It's a huge void. We're all going to feel at different levels. And certainly from a regional perspective, being a stalwart with the county for so long, you've been a mentor to many and a figure that we all aspire to be in the realm of policymaking and maneuvering all that needs to be maneuvered. So wish you the very best and really miss the opportunity to work longer with you in this capacity because I was looking forward to learning a lot from you. So best wishes to you.
Thank you, Chris. Thank you. That's really
Thank you,
nice.
Chris. Helene Schneider from the
Helene.
USICH. She's here.
I flew in
Helene.
from the feds. Hi everyone. I don't know if everyone. Hi Bruce. I'm Helene Schneider. I'm with the U.S. Interagency Council on Homelessness, regional coordinator covering the state of Arizona. And I'll be really brief just to say thank you to Bruce. I've been on this job now almost 4 years in January, and you've always been a great resource. I hope I have been the same for you, and really want to express my appreciation to everyone on the call, and please call on me as your federal partner here on homelessness. But Bruce, between you and Jody, you're going to do amazing things. A little troublemaking here and there, if I know both of you pretty well, and all in the good sense, So, but you've literally saved lives throughout the county for many decades and helped people elevate to their best potential under very challenging circumstances. So just the best to you as you move forward in this next chapter. Take care.
Thank you, Helene. That's
Thank you, Helene.
Thank you.
Are there any other board members that would like to make comments before I turn it over to Katie? Katie, have you received anything yet? No. Okay, Bruce. I think it's your turn, although we'll come back to at the end of the meeting.
This is really hard. Thank you all so much. 6 years with the Continuum, that I forgot that myself, and the proclamation captured some things in my career that were really special. So I really appreciate that. I really love this job. It's just a matter of having done this work for so long and the intensity. These are hard jobs. And COVID, my capstone COVID event here, the last 18 months, all of us are doing the same thing, 10-hour, 12-hour days in front of these damn computers or with masks. And it's been hard work, but it's been really good work. God, everybody really came together, and everybody on this continuum of care. I feel like, I have a special relationship where I can call any of you, or you, I hope you've always felt you could call me and say, what are you doing? And we just speak directly, or it's all about just getting the job done. And so it's really been great. I'm so proud of what the county has done. I told the story at the homeless conference that when I got the job, the person who had the one contract we had with a large human service shelter provider said, here's the contract. This is very political. You just give them the money every year and don't ask questions. And I laughed. I said, oh my God, that's not how we do things anymore here. This is a new day. So now looking at having $62 million of ARPA money on top of what we have normally, it's been a hell of a year, but an exciting year. So I've been disappointing everybody who say, are you going to Europe? I don't have any plans. I plan to figure out my plans. I plan to rest. I plan to slow down and then see what happens. So I'll kind of figure it out is the plan. But you friends can all feel pretty secure. You all know Rachel Milne and the amazing work she does to really lead all our efforts and get the job done. We kind of conceptualize where we want to go, and Rachel always makes it happen. We ran a homeless encampment for a year. That was different. And I don't advise it. Anyhow, so much done, so much more coming. I can share with you, the announcement's not out yet, but Jacqueline Edwards will be the Human Services Director. My current deputy now will be taking over. And so we developed our partnership principles together, our management style together. We've done everything. So she knows how to get the job done. So the county government and the county in general is going to be in great shape moving forward. So, and I'll be following it. Thank you so much. This was really special. Appreciate it.
Thank you so much, Bruce. You might want to look at the participants list. There's lots of hearts flying and things like that. And we will circle back if anybody sent in comments by the end of the board meeting. Okay. All right, hard to move on from that. We are going to miss you dearly, Bruce. But we will move on to our next item on the agenda, which is call to the audience. Members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. However, we would like to make an effort on future meetings to make it even easier for the public to participate. So to increase public participation in a safe and virtual format that supports board discussion and public input during the Regional Continuum of Care meetings, we invite anyone wanting to attend the meeting to request the Zoom link from staff, or there will be an online form available on the MAG website to request the Zoom link. The public may attend the meeting and offer comments after board discussion on each item using the raised hand function in Zoom. So I hope that that will really make it easier for everybody. I know I get phone calls after meetings asking questions and just making a comment. And I hope that everybody will use this new way of interacting with the board to go ahead and make your comments during the meeting. We really want that. So that will be the way we move forward. MAG staff, were there any comments received for today's meeting or anyone who has joined the call to offer comments?
One person joined the call. I just have it as 679-805.
Okay. And so they should, am I correct in thinking they should just raise their hand at the part where they want to make comments?
If they could identify themselves now, just so that we have it for the minutes, and then yes, at that point they would.
Okay. Is that person able to identify themselves? Go ahead and unmute yourself and let us know who you are. Or if you are more comfortable, you could also email Katie at kgentry@azmag.gov. That would be great. That will help us for our minutes and everything else. And then go ahead and raise your hand if you want to speak. And staff, if you could just let me know, I've got my agenda up over that piece, so I can't always see that. So thanks. We will move on to the next agenda item, which is item number 3, approval of the August 30th, 2021 meeting minutes. Does any member of the board have questions or comments on the minutes? I'm not seeing anything. Staff, are you seeing anything? I can't see you either,
No.
so speak.
No.
Okay.
Not at
Thank
this
you.
time.
Okay, thanks. Could I have a motion to approve the August 30th, 2021 Maricopa Regional Continuum of Care Board meeting minutes?
So moved.
Was that Tad?
Chris Hallett.
Oh, Chris, okay.
I'll
I am
second.
only seeing one screen today, so just,
Brian,
tell me
Chris
that's great.
first and Tad seconded the motion.
okay, wonderful, thank you. So we have a motion from Chris and a second from Tad. Is there discussion on the motion? Okay, hearing none, I will ask MAG staff to proceed with a roll call vote. Please indicate clearly how you vote, stating yay or nay after your name is called.
Chair Ryan Balch,
Yay.
Eric Cole,
Yay.
Elizabeth DaCosta,
Yay.
Marshall Franklin,
Yay.
Tad Gary,
Yay.
Chris Hallett,
Yay.
Bruce Liggett,
Yay.
Charles Sullivan,
Yay.
Jackie Taylor.
Yay.
Thank you. The motion passes.
All right, thanks everyone. We'll move on to the next agenda item. TJ Reed, Regional Homelessness Project Manager at MAG, will provide an update on the regional homelessness strategies. TJ?
Thank you, Ryan. Yeah, I think Katie's going to pull up the screen share and then I'll get going here. All right. So as you all know, we added the regional strategies and action steps as an ongoing item for the board agendas to make sure that this board not only is informed, but has the opportunities to provide feedback and guidance into this process. And I know Katie is, I believe, still in the process of setting up a meeting for board members to meet offline to discuss this. But with that, I will move on and go to the next slide. So here's a timeline that kind of goes over from January to now, what has been going on. And you all are likely really familiar with this, so I'll just briefly touch on it. But January to April was really outreach and research. The regional strategies were then approved by this board and adopted by the regional council in May. And then since then, we've really been focused on taking those big picture and high level strategies and honing in on things that are more actionable that can be taken on. Next slide. All right, and so really, this is meant to be a coordinated and regional approach focused on reducing homelessness, increasing access to care, and then keeping people housed during the pandemic, during and after. Next slide, Katie. So we're really wanting your feedback on this. And then also it's just to inform. So if you have feedback during this time, you can give it. If you would prefer to have that offline in a phone call or in a meeting afterwards, that is totally fine as well. Next slide. And as you're probably well aware, the real regional action steps are focused on both the immediate and long-term actions that local and tribal governments can take with partners to address homelessness regionally. All right, so with that, let's get into the actual top level categories. So they're broken down into 3 high level categories. That's really commitment to the regional work, increasing safe housing, and then diverse partnerships. So the first one, next slide, is really related to committing to work regionally. This one has also been one of the more contentious ones with our local and tribal governments because of the discussion around buy-in around financial and in-kind. So the first one you'll see is the goal of increasing ongoing financial and in-kind resources from local and tribal governments related to regional action. So we're moving forward on trying to ensure that everybody is participating in one way, shape, or form, whether that is actually purchasing building and funding programs, or that is for some of our communities that do not have some of the financial side of that going for them. They're able to provide in-kind resources like participation in the regional efforts, staff time, land, space, etc. The next one is really improving access to data. And one of those examples is with our HMIS, our Homeless Management Information System. We want to make sure that our infrastructure for data is strong and that people can have the data that they need when decisions are coming up. And so with this, there's one particular item right now that we're reviewing with Solari, as well of one-time expenses to bolster the infrastructure of the HMIS system. And there's a lot more to come on this. And when more details come up, we will make sure that this board is much more apprised of what that is. The third one is a regional public education campaign that focuses on 2 things. One is really highlighting destigmatization of homelessness and healthy ways to give and a lot of information around current homelessness to make sure that people have the right information and that it's a standard message. The second is really around affordable housing and workforce housing. We want to make sure that the messages are out there and the opportunities for local and tribal governments to implement affordable or workforce housing are there, and that the myths or the misinformation are being addressed by having that standard language and research-backed approach to really reviewing that. And lastly is really tracking the ongoing progress of this work. This work is not something that's just a one and done. Let's get it through the board, let's get it through regional council and then put it on our shelves and forget it. This is a thing that for us to really impact homelessness, which is continually increasing in our community year over year, we have to be aggressive and we have to be consistent. So the next one is increase safe housing options. So based on data from HMIS, the system flow that was presented to this board last time, that shows our inflow and outflow and what we're projecting into the future. Based on the data from there, we said, here's the number of units that will be needed to reduce homelessness by 25% over a year. So 770 units for temporary housing. This includes all things from iHelp, traditional shelter, non-congregate hotels. There's a lot of different variability here within temporary and permanent housing that each community can kind of buy into what they see fit. Adding 1,225 units of permanent housing. This can be vouchers, but we are encouraging the infrastructure build of actually adding units. Next is really in kind of focused on the work that the county has been doing with the landlord engagement efforts. This is a partnership both with the county and also the local entities that have been doing landlord engagement to ensure that we're increasing the stock of rental units and maintaining our current relationships with landlords by really providing things like incentives and mitigation funds, and really one number or a clear pathway to get responses to concerns that you have. The next is really enhancing, evaluating and enhancing our coordinated entry system to ensure that it is meeting the needs of the community. And lastly is really support existing efforts to reduce evictions. And so we kind of are breaking this one into three categories. One is really connection to rental assistance services and eviction prevention services. Two is legal assistance and guidance. And three is really that housing stability support. So if people are going to be evicted for things other than non-payment of rent, we have clear pathways to get them connected or reconnected to the things that will help them. All right, next slide. And lastly is the diverse partnerships. So one is really increasing the interventions through criminal justice systems and the police departments and fire departments or emergency management systems. So launching new community courts is a big one. We have some popping up right now that are new. We have ones that have been going for a long time, but this is an opportunity for people pre and post adjudication to really support people in reducing some of the impacts that homelessness has on their lives. So they can get rid of fines, they can quash warrants, they can potentially get connected to services in other cases where they might not have done that to begin with. And then this is also things like the misdemeanor repeat offender programs. The second one is related to street outreach and connection to care. So really implementing street outreach programs and partnering with effective ones to ensure that those experiencing homelessness in each community can get easily connected to the appropriate levels of care. Expand employment opportunities. And this is really for those experiencing homelessness. We've noted from a lot of feedback from providers in the community that we really want to bolster the engagement with employment programs and getting people connected to the right levels of income to sustain their housing. And then the last one here is forming interdepartmental teams. As we all know, homelessness is not just a human services issue. This is Parks and Rec. This is the police departments. This is libraries. And so being able to communicate across those lines for local and tribal governments are not even nice, but really necessary to effectively reduce homelessness in each area. Next slide. All right, so, and you can go to the next one. So the next steps, here's the time frame that we're looking at. So during September, we're really engaging with feedback from you all, from our local and tribal governments, from a lot of core partners across the county. We're also including, we have several provider focus groups. We had one last week and we have one tomorrow. We're also bringing this forward to the committee and having the small group of board members to outside of this to convene. October is really kind of getting that draft out for review and comment and making any needed changes. November and December, we're hoping to get that through council. And then January and on is where the work really begins. It's when, or I guess continues, because much of this we've been working on and communities are doing many of the items. So it's really focused on implementation and pushing so we can continue to make an impact. Next slide. And you all know our contact information here, myself and Amy's is listed. So we are only a text or call or email away. So if you want to just get on the phone to chat about any particular item, never hesitate to do so. We want to make sure that your voice is heard and included in this process. The continuum of care is a vital aspect of homeless efforts in our region. And we are so thankful for you all and the work that you have put into the regional strategies and ongoing with these action steps. So with that, I will, I can take questions, or if there's any discussions from, I think first board members, we can take those now.
Hi, can you hear me?
Hi, yes.
Okay, this is Council Member Peggy McMahon. I'm out in Fountain Hills. And thank you for the presentation. I would like to know how, as a council member, how we can participate to help you guys put this in motion. I mean, how can we participate with you? Loaded question, I know. But.
Well, thank you, Madam Chair, members of the board, and Councilwoman. Thank you so much for the question. I think it is a great question. And so the ways in which we're engaging right now, we have a regional coordination team that is made up of members from each community, some from Fountain Hills, and we're meeting one-on-one as well with local mayors, town, city managers, intergovs as appropriate. And really, I think from the council perspective is working and engaging with those individuals who have been in this and driving the work forward. Also, I will say that we just met with Fountain Hills and it was a great conversation. There are so many opportunities within this for misinformation to be quelled, for certain things like affordable housing to be advocated for. And I would say it sounds like you all are doing an incredible job. And for us, I would kind of pitch it back to you as well. If there are efforts going on and underway in Fountain Hills that we can support with and really engage with you to provide you with any ammunition or support, we would be more than willing to do so as well. And I know Amy is on as well. I don't know, Amy, if you wanted to add anything to that.
Great. Thank you, TJ. And Madam Chair and members of the board and Councilmember McMahon, thank you so much. You've been so incredible with coming to the forums and with helping with all these efforts. And we really do appreciate all of your partnership in this. For every community, that participation may look a little different. And so we want to make sure that every community's participation in these regional efforts really resonates with their priorities and acknowledges the differences that exist within each community. Every community has different needs, different priorities, different levels of access to resources. And so as we're developing and fine-tuning this action plan, we are inviting feedback from each community to really deeply understand how they would like to participate in these regional efforts. And then when it comes time for implementation, we'll continue that conversation with our partners, with local and tribal governments to understand how can we support you in the implementation then. And so for some communities that might be implementing, for example, the interdepartmental teams. Other communities will be very focused on housing. Others might be more focused on outreach. but whatever their interaction looks like, we want to make sure that we're supporting you fully. And so we'll be looking to continue that conversation with our partners as well, because it's not just up to local and tribal governments to undertake this work. Some of the work is in place already because of local and tribal governments, but also because of our community partners. And so we'll look forward to continuing those conversations with everyone involved.
Thank you very much. I appreciate it.
Thank you. Appreciate your continuing partnership in this space, Councilmember.
I appreciate yours, and I really, really appreciate your help with our CARES forum that we're having at the end of October, and your great participation as one of our panelists. So thank you very, very much.
You're welcome. Thank you so much for that invitation. This work, the way that it gets real is by going to each community. And so I really appreciate you inviting me to that event and look forward to working with you on it.
Thanks, Amy and TJ and Councilwoman. Are there other comments? I'd like to recognize Liz, Board Member Liz. Please go ahead.
Excellent. Thank you. Thank you so much for your work. It's so nice to see such a thorough action plan, and especially around the slide around increasing housing options, big units for temporary housing and then units for permanent housing. I just wanted to get thoughts on what it would look like to also services for prevention action. Because if we add units and we don't have a kind of best practice for those temporary housing units, we may not be able to turn them as quickly as possible. So any thoughts on adding standardized practice to increase safe housing options?
Yeah. Madam Chair, members of the board, and Liz, you were breaking up a little bit. Let me make sure I understand the question. So you're saying, is there ability to add, not just create those units, but have best practice standards attached to the creation of those units? Is that what you're wondering about?
Yeah, hopefully if I go off camera, maybe you hear me now.
A little bit.
Oh, no. Of course. Well, it's because it's so important. No.
Yeah, right.
I just add standardized best practice for intervention. Apply it to temporary housing, apply it to rapid rehousing, permanent supportive housing.
No, that's great, Liz. And yeah, it's still a little choppy, but I think I get what you're saying. And that makes a lot of sense. And the feedback is well taken of, it is not just the creation of those units. It is ensuring that there is some level of standard practice to be done appropriately to make sure the outcomes are what we would really like them to be.
And so if I may, just in having conversation with Liz, TJ, can you just speak to, is there going to be a place and time when we, as part of this plan, are looking at our practices around each intervention in our community and updating them or standardizing them, or when and where might that take place?
Absolutely. And so I would say there are a couple of things here that I would mention. One is, in the regional coordination team meetings, we have talked about standardization of contracts. So when municipalities, local and tribal governments are putting forward funds, we're trying to get basically that funders collaborative back together to ensure that we're all promoting the same messages. So if there is a rapid rehousing program that is being funded, or a street outreach or a shelter program, that they are modeled after the best practice standards. I know we have some adopted by the board for each intervention, and those can, I think, to Ryan's point, be reviewed and potentially updated as needed. The second part is something that will be presented at the next board meeting, is the opportunity for a learning management system, which is really providing a one space for standard trainings. And within that sort of technology model, we can align COC practices to really say that if you're a shelter program, here's the expectation of trainings on a macro and micro level for those particular interventions, to make sure that whatever program is being implemented has that same access and standard level of training. So those would be the two responses, but I definitely think there's an opportunity for us to add that to the board's agenda even, as can we review those best practice standards that were developed several years ago, make sure that they are up to date or inclusive of anything that is new, and then really pair that with that funders collaborative and opportunities when funding is coming up.
Madam Chair, Board Member DaCosta, this is also part of the review of the charter, which is agenda item number 6 today, which we're asking for a group to come together to be part of the board charter review. So this may be a time where we separate the board charter from best practices and have 2 groups meet. And we can discuss that in 15 minutes when that item comes up, if you so choose.
Thanks, Katie. And I would just like to make a quick comment to what you were saying, TJ, about bringing interventions to the board. I would hope that first they will go to the committee where all of our experts who are actually providing the services are. And so hopefully that will be part of that process. Any other comments from the board before we move on to the next agenda item or the public? I am not seeing any hands raised. So thank you so much, TJ, and everybody for your input. We are going to move on to the next item. So Julie Montoya and Katie Gentry, Human Services Planners at MAG, will provide an update of the Notice of Funding Opportunity. Julie will give an overview of the timeline and rank and review interview questions. Katie will give an overview of past scoring and request volunteers for the formation of the Appeals Subcommittee. Katie, Julie?
Thank you, Madam Chairwoman, members of the board. Yes, the 2021 HUD COC Notice of Funding Opportunity, or the NOFO, was announced on August 18th, and the COC funding competition is now open for new applications, with final submission of the COC consolidated application due to HUD by November 16th. An announcement for applications went out and a local COC kickoff meeting occurred on September 9th. This meeting covered the announcement of HUD funding, HUD application requirements, and the timeline. There were approximately 60 attendees, including our board chair, Ryan, who was able to greet everyone and offer support from the COC board. So thank you, Ryan, for attending. A timeline of the 2021 COC competition calendar has been created and is posted on the MAG NOFO webpage under 2021 NOFO materials. And I believe it's also in your packet if you've had a time to review. The timeline lists dates for events and deadlines for specific items. A few timeline items of importance are that local and draft HUD applications in eSnaps for new and renewal applicants will be due to MAG by this Wednesday, September 29th, and final project applications submitted in eSnaps will be due by November 5th. The week of October 18th has been set aside for the Rank and Review Subcommittee to meet and hold applicant interviews. The Rank and Review Subcommittee will then provide preliminary priority listing recommendations to you, the COC board, on October 25th, when the board will approve a preliminary priority listing. Any appeals will be due to MAG by October 27th. And if any appeals are submitted, an appeals committee will meet and an ad hoc board meeting will occur on October 29th to approve a final priority and notification to applicants, which will occur on or before November 1st. So also in your packets, you have received the Rank and Review Subcommittee interview questions that we are asking for approval for today. Katie, are you able to bring those up?
Yes, can you see them?
Yes, can everybody see them?
Yes, they're visible.
Okay. So also the COC committee was able to review and provide feedback on these earlier this month and approve the questions with some minor revisions. These questions will allow for the Rank and Review Subcommittee panelists to add additional discretionary points to application scores. The questions mainly remain the same from the 2019 competition, except a question was added on addressing racial inequities. And for renewal PSH applicants, a question replacing the move on strategy question instead asked about strategies to overcome housing costs and limited availability challenges. For new project applicants, a question was added asking if the project is aligned with the regional strategies. So I'll stop here for any questions, or Katie, I don't know if you want to continue on with your piece of the presentation.
I would say stop for questions.
Okay.
Does anyone have any questions about the timeline or the new questions? Okay, I don't see any, Katie, if you want to continue on.
The next step would be asking for volunteers for the rank and review subcommittee, or if there is an appeals subcommittee, after you all select the rank and review, then a group of 3 board members have to meet and review the appeal and potentially submit another, potentially change their rankings. And so I would like to ask 3 of you to volunteer, and we will get that on your calendar as soon as possible. The date of that would be October 28th.
So for clarification, Katie, the rank and review committee, which has already been selected, will rank, and then you're asking for 3 board members to volunteer in case there is an appeal, and then they would be able to decide, make that decision.
That
And
is
the meeting
correct.
will be October 28th.
Chris, I see you half raise your hand. Is that a yes, I'll volunteer?
Yeah.
Awesome.
I was gonna volunteer for the other one, but it sounds like it was already set up, so.
And this will be if you don't have to, if there are no appeals, then you would not have to meet. So it's just in the case of if there are appeals.
And just for your knowledge, Chris, board members can't serve on the rank and review committee because we do the final approval of applications. So.
Is there an opportunity to get a list of the currently funded ongoing projects and how long they've been funded to get to our future review, just for edification and history?
Yeah, Chris, we can provide that and get that over to you.
Okay, so I'm looking at the participant list. Board members, this would be your moment to volunteer. Katie, I'm certainly willing, but don't want to take, if anybody else wants to volunteer, I don't want to take away an opportunity for someone to do that. And if we don't see any volunteers today, please let Katie know. And if we don't get enough volunteers, we'll reach out to some folks and see. People might need a little moment to check their calendars for that day and stuff. Katie, how long do you anticipate that meeting would be?
Less than an hour is our anticipation based on appeals. We do have to review or approve this subcommittee and the members. So if if you could check your calendars and approve that today, that would be great. If not, we can approve it at our next meeting on the 25th.
Okay, so it would be an hour on October 28th. All right, so board members, let's try to get this done. I will volunteer, Katie. Anybody else? Someone must want to join me.
I'm assuming if we are going in for proposal, you don't want us on the committee, right?
That is true.
That is correct.
That is true.
Jackie.
Otherwise, I'd be happy to serve. I'm just kidding.
Chris, is this something you might want to do?
Chris just volunteered.
Oh, okay, perfect. So we have 2 people.
Ryan, you and Chris right now, and you just need a third.
Okay, and it has to be somebody that's not from an applicant agency.
So
I know.
This is Matt from
Hi,
Mercy
Matt.
Care. Can I volunteer then?
I don't know. Staff, can Matt volunteer?
Matt cannot. He doesn't sit on our board. He is sits on our committee.
I wasn't sure what the requirements were. Thank you.
Right.
Sorry, I didn't mean to.
Thanks, Matt.
I appreciate the offer.
Ryan, I will follow up with people over email and then we can vote on it. Oh, Tad, I saw that on you.
Well, I was gonna like, can I have a delegate? And would my delegate be Matt? So
Excellent question.
Fortunately, also not, I
Oh.
believe. However, I'll follow up and then
Okay.
we can vote on it, approve it at the October meeting.
Okay, or if anyone sees that they can do it in their schedule by the end of this meeting, please let us know. Do we actually have other eligible board members? Or is there, okay. So let us know if you're an eligible board member. If you let Katie know by the end of the meeting, we can go back to a vote. All right, so I'm gonna go ahead and move on. Oh, yep, I'm gonna move on for now, okay. All right, the next agenda item is the Continuum of Care Charter. As
Wait,
you know,
Ryan,
did I
hold
miss
on.
one?
Sorry.
Okay.
I didn't finish yet. Can you
Oh,
see
I'm
this
sorry.
on your screen? Ryan specifically asked for a review of our past scores over time. So from 2017 to 2019, specifically looking at our collaborative application scores. And so on this presentation, you'll see that the scores from 2017, 2018, and 2019. In 2017, the blue score you'll see is the median score. So that's across the country median score. The green score would be the weighted mean, which is based on how much money you get, what is your score. And then the red score is our score over time. And then lastly, the yellow across the top is the best national score. Oftentimes what HUD recommends is that if you are scoring above the weighted mean, you will typically receive additional dollars. So in 2019, we were above that mean and we did see an increase in our dollars. The biggest areas for improvement, especially over the last few years, are our income over time, increasing that income for people who either cash income or people who are on a fixed income, our length of time homeless, and then our returns to homelessness. And that,
Are you trying to show us something, Katie?
No, just this.
No, okay.
Have you seen, can you see this presentation?
I can see it, Katie.
I can see it.
Awesome. It's just like a graph.
Okay.
Are there questions, things that I can answer about this? Ideally, as we start to move forward, kind of our goal would be, when Ryan asked for us to discuss this, figuring out where can we continue to improve in the COC, and as there's been a lot of changes within the COC, how can we continue to increase job and income growth as well as decrease our returns to homelessness and length of time, which is where we've had those biggest changes. From 2017 to 2018, you'll see a big jump in our Maricopa regional score. And the biggest reason for that is we brought in home base and started to do our rank and review differently. So we had a lot more direction with our rank and review. It was a lot more objective. And we started to score applications a lot stronger. And that's where we went from almost no points to having almost full points on that section of the collaborative application.
Thank you, Katie. That's really helpful. Like Katie said, I had asked for some education about where we've been in the past, where we're going, and how we can strengthen our score. So my hope is that next year, when we go into the application process, we can discuss what are the areas we need to, where are we doing well, and what are the areas we need to improve on, and then how can we incorporate that as education to our providers to help them improve in these areas. And then how do we consider that in the application process, especially when we're looking towards new applicants? So how do we help current providers, because we don't want to stop the investment into our current system. How do we help them improve in the areas where we need to improve? And then how do we look at applicants for new projects in the specific areas that are really important to us? How do we evaluate how they're doing in those areas so that we are ensuring that we're bringing on, applicants that are going to just help us improve as a whole? So does anyone have any questions or comments about this piece? Okay, I'm not seeing any hands up or anything, so I will move on.
The last thing, Chair, you need to have a motion to approve the interview questions so that those can be used in this process.
That's right. Okay, thank you for keeping me on track. Okay, so I would look for a motion to approve the rank and review interview questions. Just that. We're going to hold off on the formation of the appeals subcommittee. So do I have a motion to approve the rank and review interview questions?
So moved. This is Tad.
Thank you, Tad. Do I have a second?
This is Liz. I second.
Thank you, Liz. So I have a first from Tad and a second from Liz. Is there any discussion? Okay, seeing and hearing none, I will ask MAG staff to proceed with the roll call vote. Please indicate clearly how you vote, stating yay or nay after your name is called.
Chair Ryan Balch.
Yay.
Elizabeth DaCosta.
Yay.
Marshall Franklin.
Yay.
Tad Gary.
Yay.
Chris Hallett.
Yay.
Bruce Liggett.
Yay.
Charles Sullivan.
Yay.
Jackie Taylor. Jackie, I think you're still on mute.
Sorry, that was a muffled yay.
Awesome. Thank you. The motion passes.
All right. Thanks, everyone. And thank you, MAG staff, for doing all that work to update the questions and to review our past successes. I appreciate that. So the next agenda item is the Continuum of Care Charter. As you know, we approved the mission, vision, and values back in May, but are still reviewing the remainder of the charter. As such, I would like to ask volunteers to be a part of a work group to review the rest of the charter to bring feedback to the board. The committee and subcommittees have been reviewing the charter and have made suggestions for changes, which will be brought to this work group. Is there anyone interested in being part of this work group and able to meet over the next few weeks prior to the October meeting?
This is Liz, and I want to volunteer.
Awesome. Thank you, Liz.
This is Tad, and I'll volunteer too.
Awesome. Thanks, Tad. All right, I will volunteer, Katie. If anybody, so that's a great start. We have 3 people. If anybody,
I'll volunteer.
Chris?
Yep.
If anyone else wants to volunteer, just let Katie know. And she will, I assume, get us scheduled. Appreciate that. I really look forward to gotten a lot of comments and questions from the public about when we're going to finalize this stuff. So I'm glad we're getting some meetings on the agenda. All right, moving on to the next agenda item. This is our updates. So an update will be provided from the Maricopa Regional Continuum of Care subcommittees on recent activity. So I'm going to start by inviting Subcommittee Chair Matthew Kelly, who's the lead housing liaison with Mercy Care, to give us an update on the coordinated entry subcommittee. Matthew?
Hey, Ryan. Thanks. So quickly, it's a lot of the same stuff, but we're making some progress in different things. So we have been working on integrating homeless prevention into the coordinated entry system. We have a meeting scheduled for tomorrow. We've got the policy pretty much finalized, and we're also going to have a draft questionnaire that's been pulled together. We've received feedback from racial equity partners. In addition to that, the language we had on the initial tool was really focused towards staff completing the tool. And so we're updating it to add language that's going to be a little bit more member focused or person focused, so that it's a little more straightforward and a more understandable question to an individual who's probably being questioned. We'll be presenting all of that tomorrow at our work group. And then from there, our plan is to go ahead and bring it to the committee for some feedback, just to see if there's any additional feedback. As part of that, in this whole process, we have met with DES to make sure that the questionnaire meets their minimum threshold as far as the data elements, and then also met with Solari to determine what we needed to have added to the HMIS system, which is more or less an additional small questionnaire for the individuals who were screened and not approved for the homeless prevention dollars. And we're just having that integrated into the HMIS system. There's already a program set up for individuals who do receive homeless prevention dollars. So we're just going to utilize the already existing setup that way. Then at this point in time with the racial equity work, I know we've been working on finding out what other communities we're using as far as tools across the country. We had met with 4 different communities, and tomorrow we're actually meeting to do the debrief on that meeting and kind of decide what our next steps are going to be. So that slowly is chugging along here. Nothing super exciting to report as of yet, but I definitely hope that we're going to have some exciting work. And lastly, the coordinated entry subcommittee is completely full. We have 13 of 13 seats filled at this point in time. We were able to add Levon Lammy from City of Tempe as the ESG representative, and then also Ashley Bratz from CAS as the singles representative. So we're super excited to have a full committee, full representation. So that is my update. Thanks.
That's fantastic, Matt. I'm going to turn it over to board members for questions in a minute. I have a question. Back to the prevention piece.
Yep.
Am I making a correct assumption when I ask if the prevention is eviction prevention, like rent and utility assistance payments? Is that what you're referencing?
So it's specifically the homeless prevention dollars that are funded through ESG. So it's not all eviction prevention. It's specifically the one category that's funded through DES. Those dollars were what were mandated to be integrated. In the future, I know that you had previously asked about integrating some of those additional funding streams into this process. And I think that's something that we're thinking about, but it's not necessarily the requirement at this point. So we're doing what we need to do to meet the coordinated entry requirements as of this time, just to get the system up and running.
That makes perfect sense. And
yeah.
I don't know if incorporating the other pieces actually makes sense because those folks are housed at that point. But I guess that's a whole nother discussion. We should definitely have at some point. But what
so your
prevention service?
Yeah, and your point is completely, I think, valid. And I think when we start to think about somebody being screened for that resource and maybe not qualifying for it, how are we referring out to other resources that exist in the community and how are we connecting individuals? And so I think that will be a piece of this discussion as we move forward, but fully integrating it may not be the answer at the same time.
So what is the service that is being integrated? Like
just specifically homeless prevention, and I can get you the specific requirements through the ESG funding stream as to like who qualifies for that. It's a very specific subset within the ESG dollars, but I can go ahead and send that over to you, Ryan, just to describe it. But it's a very small piece. Yeah, for sure.
Okay, great. Other questions from the board or members of the public? Just raise your hand or speak up. All right, I'm not seeing anything. Congrats, Matthew, on getting your committee filled and on all the great work you're doing. And thank you so much for continuing to participate and report out to us.
Can I say one last thing?
Absolutely.
We'd like to make sure that the coordinated entry committee is as transparent as possible. So if there's anybody here who's interested in participating or coming to the meeting, please feel free to reach out to myself or TJ to get an invitation. You are always welcome to attend. Clearly voting members, when we do vote, will be the only people to vote, but we are open to discussion and conversation from all parties from the community.
That's great. Thank you, Matthew.
Thank you.
I think people are interested in participating, so that's
great.
All right. Next, we will hear from Nikki Stevens with MAG, who will provide an update on the Coordinated Entry Racial Equity Demonstration Project. Nikki?
Hello, Madam Chair and members of the board. I appreciate allowing me to just provide an update. So back in, I want to say August, Amy Schwabenlander had brought to our attention an opportunity by HUD to participate in a national competition through SNAP for Racial Equity and Coordinated Entry Demonstration Project. So I did submit a letter of intent to apply. We did get to round 2 and we were able to be interviewed by HUD for this opportunity as well. It was myself and Julie Montoya from MAG, Richard Cruz from the Human Services Campus, Stephanie Crum from Solari, Tish Gambino from UMOM, and we all attended an interview panel where I felt like I was being interviewed for a job, but they actually asked us some really good questions about what our community is doing around racial equity and why this would be important to bring this to our community. So we gave an update on what's being done right now. I feel like we're way ahead of the game across the country. Matthew did bring up the point that we had already met with some cohorts nationally and with Tucson around what they were doing to create a more equitable system for the people that they were serving. So we should be hearing back around October 4th, whether or not our community has been chosen for this project through HUD. So I am open to answer any questions anybody has.
That's super exciting news, Nikki. Does anybody have any questions? Okay, I'm not seeing any. Thank you so much, Nikki. I really look forward to hearing hopefully a very positive verdict on that one.
Me too. And thank you for your support, Ryan, allowing us to move forward with that process.
Absolutely. All right. Do any board members or member of the public have any additional questions on any of those updates? I didn't see any, so I'm going to go ahead and move forward. Our next item is request for future agenda items. Do members of the board have any action or discussion items you'd like to see on future agendas? Katie Gentry, I see your hand up.
I have 2 things. Number 1, we do have an item. Ms. DaCosta asked for the board to review the best practices for specific interventions as part of the charter and discuss the restart of the best practices group. We will be adding that to the next board meeting, and we will also be sending out a survey to board members to specifically ask what work groups you would like restarted and to rank them. So you should see that in the next week or so, board members coming from us. Secondly, we also have had a 3rd person volunteer to be part of our appeals subcommittee. So if we want to go back after we finish out the agenda items, we can go back and vote on that. Sure.
That would be great. Let me just, okay, that'd be great. We will circle back. Any other board members have items for future? I'm guessing, Katie, based on what you just said about surveying board members about what committees we want to move forward with, will that be also a future item for voting on?
It'll be a future item we will present information, probably for information and discussion, not necessarily a vote. We're more just trying to figure out what work groups to start, as these are just directed by the board, not necessarily need to be voted on.
Okay, and if our public members have ideas about what committees we should start or not start, can they email you on that? Perfect, because I'd like the board to consider that as well. Perfect.
That can be part of the presentation based on survey results.
Great. Okay. Thank you very much. Anything else before we move on to the next item, which is comments from the board? So I think I'll just move on to that item. Does anyone have any comments? Actually, let's see. Yeah, comments, announcements, or events they'd like to highlight. All right, if not, I would like to circle back to item number, I think it was 5. Okay, item number 5, so we could vote on committee members for the appeals subcommittee. So if I'm not mistaken, the folks who volunteered are Chris. And who else?
You and Eric Cole.
And Eric Cole. Okay, fantastic. Can I have a motion to appoint those 3 members to the Appeals Subcommittee?
Moved.
Who was that?
Jackie.
Jackie. Thank you, Jackie. Can I
This
get a
is
second?
Marshall. I will second it, Marshall.
Thank you, Marshall. So I have a first from Jackie and a second from Marshall. Any discussion? Okay, seeing and hearing none, I'll ask MAG staff to proceed with the roll call vote. Please clearly identify yourself with a yay or nay.
Chair Balch.
Yay.
Elizabeth DaCosta.
Yay.
Marshall Franklin.
Yay.
Tad Gary.
Yay.
Chris Hallett.
Yay.
Bruce Liggett.
Yay.
Charles Sullivan.
Yay.
Jackie Taylor.
Yay.
Katie, I think you missed Eric Cole.
He had to jump off.
Oh, okay. Thank you.
Thank you.
Okay. Motion passes. Great. Motion passes. Thank you everyone for volunteering. And then before we adjourn, Katie, I just wanted to ask if there were anything submitted from public. Nope. Okay, well, I want to say one final farewell to Bruce. Bruce, thank you from the bottom of my particular heart, just for your service in the community, and also for the pleasure of working with you on all of the very interesting projects that you and I have worked together on over time. I learned so much from you during that time. For me, most about how to conduct yourself as a leader and how to build partnership and create space where everyone can truly participate. You do it like none other, and I have been blessed to be in your presence and learn from you and watch that. And I hope that I'll be able to take some iota of that with me into the future. So thank you so much. And fond farewell from everybody. And with that, the meeting is adjourned. Thanks, everyone.